Good morning, everyone. This is Bill Miles with the Hilton Head Island Bluffton Chamber of Commerce, and certainly would like to thank each and every one of you for joining us this morning. Last week, we had over 500 people on our call, and this week we're happy to be reaching an even wider audience this morning, thanks to our partnership with the Beaufort County channel. Today's call is being broadcast live to households throughout our entire region. We've heard tremendously positive feedback from you, our members, our community about these calls and the ability to hear timely, unfiltered information from our community leadership. We're covering just about every facet of our community, from education and healthcare to the SBA and our mayors and town leadership. It's been heartening to see so many in our community and around the country supporting the various charities and programs to assist those facing the unemployment challenge brought on by COVID-19. We're both hopeful and optimistic that the Senate will vote this afternoon to support the $2 trillion coronavirus bill after a landmark agreement with the White House. And as we've discussed previously, it's important that we know the facts over fear, rumor, and speculation. And to get us started with that this morning, we're delighted to have Tom Sullivan, the Vice President of Small Business with the U.S. Chamber of Commerce. Tom and his colleagues at the U.S. Chamber, along with state chambers of commerce and your local chamber of commerce, are fighting hard for business, jobs, and families literally 24 hours a day. Tom, welcome to our call, and thank you for taking time to join us this morning. I'll turn it over to you.
Well, thank you, Bill. Actually, not 24 hours. I've tried to get at least 4 hours of sleep, so like many of the small business owners on the line, we're at about working 20 hours a day trying to help out. So thank you, and thank you for letting me talk with such a broad and great group of your membership, along with others who have joined. I want to start by complimenting you, Bill. For those of you who don't know, Bill is part of a group that represent the top 100 chambers of commerce across the country. We were together a couple of weeks ago to try to gain information from other parts of the country on what chambers of commerce are doing to help their communities. And we were able to hear from Washington State Chamber, as well as the Tacoma, Washington Chamber, which had been ground zero in the coronavirus pandemic at that time, learned some tremendous things that I know Bill and others brought back to their communities in order to help us weather through this pandemic. As far as the U.S. Chamber goes, we're certainly relying on the advice of Bill and others. We also really have a fundamental mission, and that mission is that no family should be devastated and no business should be bankrupted due to the temporary interruption caused by the coronavirus pandemic. That has driven all of our activities over the past, I'd put it at 12 to 15 days. It seems like 2 months, but it's been about 12 to 15 days where we're working around the clock to try to help. We've really tried to look at all three pieces of legislation so that we don't combine them all and make a crisis situation even more confusing. The first legislation, which was signed into law on March 6th, allowed SBA, the United States Small Business Administration, and I know, Bill, that you work very closely with the district office of SBA. But on March 6th, Congress passed a law in lightning speed that leveraged up to $7 billion in disaster loans for SBA. And SBA immediately started accepting applications, and they're working through that. On March 18th, the president signed legislation that really is devoted to making sure that workers continued to have paychecks, and issued a requirement that all employees be kept on the payroll, and if not, be paid for leave, and then allows that leave to be reimbursed by the federal government so that the business community doesn't bear the brunt of that action. Department of Labor is exempting 50 those businesses with less than 50 employees. We expect those rules to be finalized next week. And then last but not least, Bill, is what you referenced that hopefully we are hoping will pass the Senate this afternoon or at the latest tomorrow. And that puts an additional $350 billion of aid to the small business community. And it's a mixture of things. It gives even more authority to SBA. It also allows for small businesses when they devote those disaster loans to keeping their employees on the payroll, though that money equates to a grant, not a loan. So we've been pushing for those provisions. The text is still being written as we speak. It's 9:30 in the morning now. I think to use an old law school analogy, I think pens are down for the test at 11 a.m. They speed to a vote, and hopefully we'll get a summary of that legislation to you, Bill, and to
no, go to the agency. Barely anyone's going there.
And so that's the summary of the three pieces of legislation. Not only did we fight for a lot of the provisions, but now we're directing our attention to translating that legislation into information you can use to help your business community. The website that we're driving folks to is uschamber.com/coronavirus. Thank you, Bill.
Tom, thank you very much. And while you were talking, we had one question that came in that I'll ask you. It's will the new federal programs or any state programs help micro businesses? In other words, businesses that have no employees. Are you familiar with that yet?
Yes, it's a great question. There was so much focus on employees and people continuing to have paychecks. There was a realization that the self-employed, which actually make up over 80% of America's small business community, those small businesses that do not have employees, legislators forgot about them. And luckily, we were able to correct that misstep. And the non-employer community also will receive benefits from this latest legislation that should pass either this afternoon or tomorrow.
Thank you. Thank you for that answer. And Tom, I know you've got lots of things going on. We may have other questions. I know you need to run. If we get other questions, we'll be in touch with your staff and get those answers back out to our members in our community.
Thank you. We're here to help and never shy away from asking. We're going to try to answer them or point you in the right direction to get an answer. So thank you, Bill.
Tom, you and your team are doing a terrific job. Thank you. And go get them this morning and this afternoon.
Well, thank you.
Okay. Next, we're gonna rotate to Dr. Michael Katka with DHEC. And are you on the line, Dr. Katka?
I am. Can you hear me okay?
We do. Yes, sir. Welcome and thank you for joining us.
No problem. Thank you very much. I'm Dr. Michael Katka. I'm the section lead for medical consultants in Division of Acute Disease Epidemiology at DHEC. Basically, that means we're the physicians who are engaged in disease investigation and control. I'll give a little update here, talk about what DHEC's doing, and be available for questions after that. So as of late yesterday, South Carolina has confirmed cases of COVID-19 in 36 counties. Today, we've reported 342 confirmed cases from our public health laboratory and private laboratories as well. Our public health laboratories performed over 2,300 tests. 90% of those have been negative. Beaufort County has reported 22 cases total, and this includes 16 new cases since last Wednesday, March 18th. Sadly, this now includes 7 reported deaths of patients who had previously been reported to be diagnosed with COVID-19. Each of these patients were elderly, and all but one had underlying health conditions. No deaths have been reported in Beaufort County at this time. I would like to provide a situational update on the status of COVID-19 in the U.S. and here at home. According to the CDC, the U.S. is now in the initiation phase of the pandemic. This is based on the Pandemic Intervals Framework, which describes the progression of an influenza pandemic in six intervals or phases. The duration of each phase might vary depending on the type of virus and the public health response. Different parts of the country are seeing different levels of COVID-19 activity. Nationally, the U.S. is currently considered to be in the initiation phase. States in which community spread is occurring are considered to be in the acceleration phase, and that includes South Carolina at this time. This means the need for us to transition from individual contact investigation to prioritized investigation to those at high risk and are community focused. Realizing that spread is occurring, we encourage the public to focus on things that each of us can do to limit the spread of illness. This includes washing your hands and covering your mouth when you cough. Be assured that public health officials are working to protect the safety and health of all of our residents. As the lead public health agency in South Carolina, one of DHEC's primary missions is to protect and promote the health of the public. One critical activity that helps us carry out that mission is conducting surveillance of selected infectious diseases. The principles of disease surveillance are to collect information about where diseases are occurring, to analyze the data so that we can understand who is being affected, and then to interpret and share information that prevents the spread of disease. This will be an extended response, and we want people to be prepared that more cases will occur, and we want them to continue to listen and follow recommendations from public health officials and their physicians. We recognize the hardships that many are facing in South Carolina. It is important for not just our older residents, but for all of us to protect our mental and emotional health during this time. Remember, everyone copes with stress differently. To ensure that you protect your mental and emotional health, please take breaks from watching, reading, or listening to news stories and social media. Hearing about COVID-19 or other stress-inducing issues repeatedly can be upsetting. Please take care of your body. Eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and avoid drugs and alcohol. Make time to unwind and participate in activities you enjoy. Connect with others. Talk with people you trust about your concerns and how you are feeling. We tend to spend the most amount of time interacting with those we live closest to. That understandably raises concerns about what level of caution we should take to do necessary activities. Everyone should continue to monitor for symptoms, practice social distancing, and avoid touching frequently touched items such as doorknobs or rails, and regularly wash your hands, and always after being in a public place. People with signs of illness must stay home and avoid public gatherings. Those who are charged with caring for a family member, friend, or neighbor who is at greatest risk for becoming ill are asked to follow information provided by the CDC and DHEC to safely provide this care at home. This is an emerging, rapidly evolving situation, and DHEC will provide updated information as it becomes available. We will continue to provide updates on our webpage, which is at scdhec.gov/COVID-19, COVID-19. And I'm happy to take any questions at this time.
Thanks, Doctor. One question we had that we saw that there was a little bit of a spike in numbers from testing over the last couple of days. I understand that some of the labs are not reporting on a daily basis and some of the private labs aren't, and that could or is the reason for that. Can you address that?
We saw, I believe, a little dip on Saturday and then a jump on Sunday. We actually had a delay in our public health lab. They had briefly run out of the reagent they needed to run the test and had to get some more in, and that delayed it by a few hours. So cases that normally would have been reported on Saturday wound up being reported on Sunday along with the regular Sunday cases. That's why there's a little weird fluctuation in the numbers there.
Thank you. Thank you. Let's see, we have one other question here. What are the 7 phases where we are in the acceleration phase, which is second?
The phases, oh boy, you're testing me out. Let me pull them up here because I'm not sure I remember them all off the top of my head. But we have we have the initiation phase where it gets introduced. Give me just 1 second here.
Okay.
So the initiation phase where it initially gets introduced. During the initiation phase, the focus is kind of doing containment, seeing if you're capable of containing the virus. This is a particular virus that wasn't containable. It's even with appropriate testing, it's believed that there's a lot of asymptomatic cases out there that make it difficult to contain it. So the initiation phase, okay, so the initiation phase is actually the third phase. So the first phase is investigation, where the investigation phase in this case mostly took place in China, where it was discovered and kind of the initial information was discovered. The recognition phase was the second phase that also happened in China. So those had already been occurring prior to it coming to America. So within the last few weeks, we had the initiation phase where it's introduced to the community and begins to spread. So we're currently in the acceleration phase where we're seeing a rapid increase in cases. And we expect the acceleration phase to continue for a little bit. Any changes that we make right now as far as social distancing, as far as closing mass gatherings, that sort of thing, remember that that's going to take a little time to see any effect. Any cases that we're going to see in the next few weeks are kind of already in place. So we will continue to see this acceleration phase and see an increase in cases. The fifth phase is the deceleration phase, where the cases start to decline. So we hope that with the changes we make in the next few weeks, we'll start to see that deceleration phase. Excuse me. And then the final phase is essentially the after phase, and it's called the preparation phase, where you learn from the lessons from what happened and prepare for future pandemics. So I apologize, I didn't have that brought up. I didn't want to just try and do that off the top of my head.
Well, thank you, and thank you for that informative answer. We're going to move on to our next call, Doctor, and let you get on with other things in your day that you need to. But thank you so much for checking in with us today.
No problem. Thank you very much for the opportunity.
Our next speaker this morning is Greg White. He's the district director for the SBA. And Greg, you heard Tom Sullivan a little bit ago, and I know our callers are interested and eager to hear from you.
Well, good morning. I appreciate it. We currently are very active, as you can be well aware of. Numerous applications are swarming the website for the online applications, and as I know some of the applicants are having some difficulty getting in there, but we would encourage you to continue to apply online for the applications. You can do it on a paper form and fax or scan it and send it to the processing office. The loans, as hopefully everybody realizes, if not by now, that they're up to $2 million for up to 30 years at an interest rate of 3.75% for small businesses and 2.75 for private, not-profit businesses. It's a lengthy application. Typical would be similar to a commercial loan that you would work through. We have, I guess, over 100 applications have been submitted and are in process right now as we speak. We are waiting to hear what the Senate and House bill comes down to. That will involve some bank commercial participation, which we were working with the Banking Association to kind of figure out how that's going to track down, and then we'll be issuing a press release jointly with them in the Commerce Department. But we are willing and able to help. We are doing webinars ourselves on an individual basis to help people with the applications and the process. Just encourage you to continue with the application. If you have any questions, please feel free to email me or call us, and we will help you. And I'll be glad to answer any questions anybody has about the SBA programs.
Greg, thank you for that. And for our callers, Hannah Horn here at the Chamber is your go-to contact for SBA things or questions related, along with the SBA. So if there's anything she can do to help facilitate conversations, please reach out to Hannah. Moving on to our next caller is hopefully we'll have time in the end for some additional questions. But moving on with our next caller is Dr. Frank Rodriguez. And Dr. Rodriguez had some interesting day yesterday, just as every day is interesting for him. Thanks for joining us.
Good morning, Bill, and everyone on the call. Thank you for the opportunity to join you today. As you all know, Governor McMaster yesterday announced that he was ordering all South Carolina schools to remain closed through April 30th. We've been preparing in the event of this. So we have, just so everyone is aware, we're focusing our efforts on two main critical areas for our students and support of our students and community. And that is, number one, to continue academic instruction for children, and number two, to continue providing meal service for kids during this time. And the third, actually, there's a third piece, which is taking advantage of this time to provide a deep cleaning in all of our facilities, where we can do some of the type of cleaning and work we would do over the summers that requires a little bit more time and lets us to get to more of those hard to reach areas. So we're taking advantage of this time to do that type of cleaning. Up to date, since this closure of school started, we have delivered just right around 30,000 meals, distributed 30,000 meals to children here in Beaufort County. They do not all have to be students of Beaufort County schools. So we're taking care of any child up to the age of 18 with meals. And so we had a change in our distribution at the beginning of this week. Instead of having a breakfast and a lunch distribution, we consolidated into one distribution window from 9 to 12, in which we're providing both meals at that time that students can take with them. So we do that through 12 distribution sites, as well as bus routes. They're not our normal bus routes. We have modified bus routes during this, and we have specific sites that are available at our Beaufort Schools site, Beaufort County School District site. Additionally, we're continuing to deliver instruction online through not only online, but through learning packets that we distributed to our families at the beginning of last week. We are preparing now for an additional 2 weeks worth of lessons, and we're going to stay 2 weeks ahead of the curve on this. We'll provide information to our families on if they require learning packets because they don't happen to have access to the internet at home. We will provide them with learning packets, and we'll have a distribution window for that, and we'll make that announcement. Our schools will communicate directly with them. Additionally, we're continuing to enhance our online instructional delivery method. So last week, we trained over 1,000 teachers in utilizing Zoom to deliver instruction. And we began at the end of last week with some of our first lessons, and we continue this week, and that's expanding over time as more teachers become comfortable in delivering that type of instruction, and puts them right in front of their students once again in a little different capacity. We've also reached out to the county channel to see about utilizing some of our staff to generate some instructional lessons and instructional programming that they might be able to run. And so that looks like a good possibility there, as well as I want to thank Hargray once again, because through the partnership, they've been able to provide free online service, free internet service to students and families that are new customers. And so I understand that there are many trying to take advantage of that opportunity and reaching out to Hargray to schedule some of that installation. Our schools are planning, as I said, to move forward through the time window that we're out. We're lessons. We're continuing to modify to see how we can reach more students with our meals as well. So thank you for the opportunity. I'll be glad to take any questions you might have.
Dr. Rodriguez, one that has come in is more of a statement than a question, I believe, but would like for you to verify this, that every student has access to a personal laptop or tablet, which gives us a leg up with online learning. Is that?
Yeah, I think two things have happened here that have given us a leg up right now. One is that as a system, we began planning for this late January, early February. And so we were already ahead of the curve when the governor issued his initial order to close schools. The second piece is that we are one-to-one. So in our third grade through 12th grade, we do have laptops that all of our students have. In our K-2 programming, we have devices such as tablets or iPads, but I think it seems to be the preference thus far in the K-2 where they're taking more advantage of the learning packets at the moment, but we do have the capacity to support as well with electronics.
Good. Another question, is there any consideration of having schools operate throughout the summer?
No, not really, not at the moment. The conversation with the state superintendent has been that our students are being marked present throughout this because they're receiving instruction, they're receiving academic work, and so they're being marked present through this. And so we're not looking at that at the moment. We have not heard anything about that. And I suspect that there will be a tremendous amount of flexibility from the State Department of Education, given this unprecedented circumstance.
Dr. Rodriguez, thank you. We thank you for your leadership and for calling in with us today also.
My pleasure. Thank you.
Next, we're going to hear from Jeremy Clark. Jeremy is the Market Chief Executive Officer for Hilton Head Regional Healthcare. Jeremy?
Good morning, Bill. Can you hear me?
We do, yes.
Excellent.
Good morning.
Good morning. Well, just like last week, Hilton Head Regional Healthcare continues to operate effectively and safely. And I continue to feel very good about the outstanding colleagues and physicians we have, the training that they've received, the equipment and supplies we have, and the processes that we've put in place and the other ones that we have planned. And I want to walk you through some of those plans today. First and foremost, we are focused on keeping our patients, staff, and physicians safe. As of Monday morning, we have eliminated visiting hours with only limited exceptions. Outside access into our hospitals has been reduced to one entrance point, the emergency department. Anyone, including staff and physicians, entering the hospital is now screened with questions about their health and travel history, and their temperature is being taken. All of this is in an effort to minimize the number of people inside the hospital and keep our community safe. Another way of assisting our community and keeping people out of hospitals and physician offices is through telehealth. Just this week, we've launched an online assessment tool that provides recommendations on the next steps for people who are wondering if they meet CDC criteria for the COVID-19 test. Further observation, they are isolated and monitored by clinicians that are trained in the use of personal protective equipment. I know that there have been a lot of questions related to capacity. I want you to know that in the event we see a surge of positive cases that need to be hospitalized, we have plans in place to continue providing care safely. We have adequate supplies of personal protective equipment available for our staff and physicians. We're tightly managing our inventory in a safe and conservative manner and are adding to our supplies from both traditional and new suppliers. We are managing the demand for supplies by taking down our census, postponing elective and non-urgent surgeries where possible, limiting visitors, and limiting our services. We're also finding new ways to work with our best resource, which is our staff and physicians. We've established a labor pool, and we are cross-training our staff today to work in other areas. We are also starting a similar program for some of our highly trained physicians. We are repurposing existing space within the hospitals to maximize our capacity if needed. We have identified ways to cohort patients so that they receive high-quality care in a manner that preserves our resources and keeps everyone safe. We're also working on ways to increase our critical care capabilities, again, should the need arise. And as always, we have contractual agreements in place with MUSC and other large hospitals should there ever exist a need to transfer patients. Finally, I know that there's a lot of fear in the community, and that's understandable. I would ask everyone to refrain from spreading rumors and instead focus on the facts. As of yesterday afternoon, there were 22 confirmed positive cases in Beaufort County, 342 in the state. Please continue to seek information from reputable websites such as DHEC and the CDC to stay informed. We appreciate all the support that we're getting for our caregivers and our organization. And Bill, I'll turn it back over to you.
Thank you, Jeremy. Thank you for that information that we all needed to hear. I've got a question here for you. And are you aware if the South Carolina Hospital Association or DHEC or any other entity is coordinating a statewide effort for needed hospital beds?
I think if there's someone from DHEC still on the line, they could probably respond best for DHEC. We're in close communication with the Hospital Association, really looking at all of our resources. But the Hospital Association would be the best resource to answer that question.
Very good. Jeremy, thank you. And we appreciate the information you provided to us. And look forward to hearing from you again next week. You're welcome. We're going to move on into with Dwayne Parrish, and Dwayne is the head of South Carolina Parks, Recreation, and Tourism, and another great partner of ours. Dwayne?
Good morning, Bill. Briefly, I'll kind of run through the latest. So hotel occupancy statewide remains around 15%, with extended stay hotels, products like Residence Inn, Homewood Suites, et cetera, faring a good bit better, actually, about double. There are a number of hotels that have closed. We are tracking this within our welcome centers. Some ownership groups have consolidated down to a certain number of hotels as the market has shrunk, obviously. On the restaurant side, some have closed there as well, but what's happened there is restaurants, while inside dining is now is no longer allowed per the governor's executive order. There is still takeout, there's delivery, and there's drive-through still open. And then a few days ago, the governor allowed the takeout of beer and wine, as well as now, as of yesterday, the delivery of beer and wine as well, to try to keep those restaurants in business, and certainly would encourage everyone to support your local restaurants as much as you can. Obviously their sales are down dramatically with the inside dining gone, but they can certainly try to make up for some of that in takeout. There have been some restaurants that have closed as well, but I anticipate that leveling out here in the next 3 to 4 days. Our state's welcome centers are all open. We provide parking for trucking, information for truckers. Obviously, the truck supply lines is critical to keep those open. We also, our staff, and to help out our staff are behind closed doors. There is a mobile number in the window that they can call at any time. We have a staff inside who can come out and help. A lot of our visitor information we have put out into the lobby area so that it can be accessed to limit interaction with our staff. Golf courses are still open, and there's some brisk local play at a lot of different places, but there are a few golf courses that have closed around the state. Lastly, state parks are closed today and tomorrow as we sort of reassess, and we've made some changes there, and I'm not going to go into all those, but we'll reopen on Friday and provide that sort of outdoor place, but limited interaction, closing off a lot of different things within the park. Pending any questions, Bill, that concludes my report.
Thanks, Dwayne. One question we have, you mentioned golf and local play for that. Are you aware of some of the safety precautions that the golf courses are taking for their players?
Yes, just three real briefly is that they are requiring one person per golf cart in there to limit interaction between golfers. Most have taken the flag out of the hole and have the cup turned upside down. And it's counted as in when the ball hits the cup to limit someone touching inside the cup. Essentially making it where there's just not any interaction or extremely little interaction, or as least as possible. But so they do have some protocols in place, and there may be some additional ones for some courses, but that's what I'm aware of at this point, statewide, actually.
Dwayne, that's great advice. Maybe we just helped figure out a way to speed up the pace of play for golf by just hitting the cup and moving on to the next hole. I like that.
Yeah. Yeah, you may be able to one putt some greens.
That's right, absolutely. Dwayne, thank you for joining in with us. One piece I would like to add to that, Dwayne talked about statewide occupancy levels, and really what we're seeing on Hilton Head Island right now is occupancy levels around averaging around 10% or so. And how does that, as far as body heat goes, looking at our oceanfront properties, our larger hotels, and if you were to take that 10% occupancy and compute out the average numbers per party, we're looking right now at about between 500 and 550 guests collectively at all of our oceanfront resorts. So you can see that the numbers, the masses certainly aren't there, and they don't expect them to return for a number of weeks, if not months. So we'll keep you posted as we go along on that. Our next speaker this morning we're delighted to have Beaufort County Administrator Ashley Jacobs with us. Ashley, could you give us an update on what's going on behalf of the county?
Good morning, Bill. Good morning, everyone. Glad to be with you all. We are open and operational with normal business hours. We've extended the business license renewal deadline to June 1st. So penalty and interest will not be charged if payment is made by June 1st. And that includes South Carolina income taxes, corporate income tax, sales and use tax, admissions tax, and other taxes filed and paid to DOR. The Business License Department is automatically applying that tax relief to all returns and payments. Palmetto Breeze has suspended service as of yesterday. So there are 3 routes that are not running. That's the USCB Bluffton to Hilton Head route, the Defusky Island Ferry Shuttle route, and then the Bluffton to Palmetto Bluff route. And all of the routes are running. The Defusky Island Ferry service has reduced public ferry transit operations to 2 daily round trips. That's effective today. There's a morning departure to Defusky Island at 7 a.m. from Buckingham Landing and returning from the island at 8:30 a.m. And then the afternoon departure to Defusky is at 4 p.m., returning at 5:30 p.m. And additionally, the 9 p.m. run on Fridays is canceled. That reduced schedule will remain in effect until further notice. We had a council meeting Monday evening, and council adopted some protocols that will allow them to meet virtually in the future, and we will do so until further notice. But we do have opportunities for the public to participate in those meetings. They can submit comments through Facebook, and we will be Facebook Live. They can also call in. We have a number that is broadcast on County Channel. We had some questions about the library providing curbside service. Unfortunately, we are not able to do that at this time. The library operations are suspended until further notice. But you still can obtain materials online, and we are offering temporary library cards to all residents. And that's all I have at the moment. I'd be happy to take questions.
Okay, thank you so much, Ashley, and we appreciate what you're doing at the county. While we're going to move right into our towns, our mayors and town managers reports.
I'll let you know.
And I'll go with Lisa Salka here, Mayor of Bluffton. Lisa?
Sorry, good morning. I'm on another call. Can you go to the next one and come back to us, please?
We'd be glad to. Thank you, Mayor. Mayor John McCann and Steve Riley. Mayor McCann and Steve.
Okay,
we'll get you.
Let's regroup. Okay, bye.
Are we there? Or with Lisa?
You're here. You're here. Thank you.
All right.
We're here, Bill.
Yes, sir, Mayor.
Good morning. This is Mayor McCann from Hilton Head Island. What I'm about to say is my opinion as mayor, not that of the town council, who will be meeting tomorrow to address these issues. I am issuing a public statement today requesting that property owners or visitors who have recently traveled to Hilton Head Island from any of the areas significantly affected by the virus volunteer to a 14-day self-quarantine. 40% of our property owners are second homeowners. The majority of them are coming from the northeast part of the country. Whether they arrive here by plane or whether they drive here, I am also asking them to self-quarantine for the 14 days. In addition, I am asking them to not invite their family and friends down to visit them during this period of time to get out of a bad situation in the northeast part of the country that does not help the situation at all. And I must tell you on a personal note, my daughter lives in New York, and she called me up and said to me, Dad, I'm not coming to visit you. And I was kind of like taken back a little. She said, I live in an area where everybody has access to being infected by the virus. I think coming to visit you is a bad thing to do, not only for myself, but for you and all the people that you love around you. So I wish you would all take that seriously along the way. This is the second thing here is that I will be asking Ashley for the county executive to talk to the FAA today about planes coming into Hilton Head from New York and New Jersey and the Connecticut area. The public is concerned about the planes coming in, carrying people from those infected areas. When we talk about plans, if you have plans for coming here, please reevaluate your plans. This is not the right time for people to visit Hilton Head Island. I implore you to come at a later date when you can see us at our best, where everything is open and we're here to welcome you and you to enjoy our area here. But once again, please don't invite your friends and family to come down and stay with you. Adjust your activities. We definitely adjust to social distancing. This is a very, very serious time in our life, and we know how great the residents are of Hilton Head. And I implore you to practice everything you can to keep us safe, our visitors safe. But the issue is practice safe distancing. Don't invite people to come visit you, and it will all be fine. Thanks, Bill.
Thank you, Mayor. Steve, do you have anything you'd like to add, or did the mayor have it covered?
I'll talk quickly about operations. We have closed the doors to public access into all of our buildings, but we remain open for business through online and phone. We're still processing a lot of permits. We did adopt an ordinance that suspends collection of local aid tax, local hospitality tax, and the business license through June 20 without penalty. Our fire rescue is out there and available and will respond, but like every public health and public safety agency out there, there are equipment, material shortages. We are in good shape now, but we are concerned about the long term. But we are there and ready to serve. Thanks.
Thank you, Steve. Thank you. Mayor Solka, are you on? And there you go. Thank you.
Yeah, thank you. I'm just trying to stay in contact with our council, and I was on a call with our mayor pro tem. I've been listening a little bit on and off because I've been talking to others around the county. I don't have much more to add other than we are all meeting as mayors and county administrator and county chair on what we can do in tandem. We believe that social distancing is something, I said yesterday, it's more than a hashtag. It is very important. And I'm looking at a site that Mark gave me this morning, covidactnow.org, that really shows on the map who's practicing social distancing, who's doing limited action, and who's shelter in place. I think it's important we stress that. I've thrown out the idea, and I'll throw it out in this realm. Next to a shelter in place by individual towns, which after hearing Mayor McCann, I think you're going to start hearing that from all of us. What kind of ordinance can we pass for social distancing? And it really puts teeth into something that gives our law enforcement something to enforce. Everyone knows what non-essential is in the state of South Carolina through the Municipal Association. I personally am one of those non-essential businesses and have decided to, work from home. And if we can't respond individually like that, we've got to look at what we can do as a governmental entity. And I don't have a feeling if all of our county is on top of that or not. I can just tell you with some questions that a couple of our council members have had that I think we can answer. We've got to look out what's best for the health and welfare of our constituents and our citizens, and also know the economy will thrive if we're all healthy at the end of this. So sorry, on a soapbox today. That's about it. I'll let Mark talk about operations.
Thank you. Lisa, good morning, everybody. Bill, thanks for having this call. I'll just go through a few things and echo really what Ashley and Steve have said. The one thing that I want everyone to look out for is we try to get our messages out consistently and daily. And the one thing that we're doing daily is Mayor Salka's putting out her daily blog. So be on the lookout for that on our social media. That has all the latest and greatest of what's going on in our municipality on that day. We're open for business. Buildings are closed with drop boxes. We're going to have our April Town Council meeting electronically. We have a good setup for that. We've canceled all other public meetings until at least April 17th. And we're just simply going week to week on that. Like Hilton Head Island until the June date, business license, A-tax, H-tax collection suspended.
We're supposed to register if you did.
And we have a lot of messages out there. I would say follow safety precautions. Common sense will prevail. It's really interesting, the phone calls that I'm receiving where people are asking me certain questions. It's interesting. We all do need to use some common sense and follow CDC guidelines. I'll say the biggest thing that's been helpful to us is as a team with Steve and Van and Bill Prokop and others, we're all staying very connected to Ashley and all the regional managers talking about emergency management, law enforcement, operations, and I appreciate the team that's gathered, and I'm proud to be a part of it. So thank you, everybody.
Thank you, Mayor and Mark. We appreciate that. We're going to move on into our airports and a couple of things. We'll go to Greg Kelly first at the Savannah Hilton Head International Airport. Greg, before you give us an update, the mayor had mentioned about flights coming in directly from New York. My first question to you is, does the Savannah Hilton Head International Airport currently have any direct flights coming in from New York?
Yes, we do.
Okay. And with that, Greg, the next question is, as far as one of the questions we have about airport closures, who has authority to close a public airport that receives, I guess would also be receiving federal funds?
Only the Federal Aviation Administration.
Okay. So a local community could not do that, whether it be at the county level, local level, municipal level. It's what I'm hearing you say. It's the federal government.
Right. This question is being asked around the country right now, and the FAA has issued guidance again, reasserting its authority over airports that have accepted federal funds as public use airports, that they have to remain open unless otherwise approved by the Federal Aviation Administration.
Okay, thanks, Greg. How about what else you would like to cover? I appreciate you answering those questions.
Yeah, thanks, Bill. Right now, our flight cancellation rate is about 50%, and that's consistent with the national trend. Our passenger counts are down 75 to 80% below last year's counts, and again, that's consistent with the national trend. From a national perspective, last year at this time, 2.4 million people daily were clearing TSA checkpoints around the United States. Yesterday, only 330,000 people nationally cleared TSA checkpoints. That's a pretty dramatic picture of what's happening around the country in terms of air travel. Businesses at the airport, including fixed-based operators, air cargo, Gulfstream hotels, and other critical operations supporting the airport overall remain operational, even under the City of Savannah shelter-in-place order. The airport, as you stated, will not close, and we're prepared to support Hilton Head Island in the recovery efforts on the back end of this incident, of this issue. And Bill, we wanted to thank you and your staff for doing a great job throughout this difficult time. Any questions?
Thank you, Greg. I think I asked a couple of questions there we had in the beginning, and I don't see any others that we have coming in yet. So thanks for joining us, and again, thanks for all you do at the airport. John Rembold, Director, Hilton Head Island Airport.
Good morning.
Good
Good
morning.
morning.
Okay, well, I appreciate Greg answering some of those questions and giving that snapshot of the industry. Just to give you a little bit more information there, I had an informational update from one of my consultants, and they spoke about each airline. But one of the majors that we're all familiar with here is Delta. And so far, Delta's parked over 600 aircraft since this has started, which is unbelievable. They've actually closed a runway in Atlanta in order to park aircraft. That's unprecedented. And just in the month of April, looking forward into April, Delta's canceled over 85,000 flights. 85,000 flights. So to tell you, Greg talked about some of the numbers and cancellations locally. We're seeing that too. It's getting harder and harder to predict and tell you how many flights will happen each day because it literally is changing every day. Airlines will tell us in the morning that they'll cancel 2 of their flights, and maybe they won't, maybe they will. So the best advice I can give you, if you are traveling or know somebody who's traveling, which is very few and far between, is just have everyone check with their airlines to make sure that the planes will actually fly. Greg alluded to this last week, but many of these planes are flying close to empty. So, if you see airplanes in the sky, it doesn't necessarily mean that they're full of people. So it's important to keep that in mind as well. Private aviation has slowed down as well, and it is still functioning. Like Greg said, we will stay open. Hilton Head Island Airport stays open as well, as we are part of the airport system. So we do need to stay open as an essential service. And so we're ready to open up the gates again when everything is better, when everything is safe, and get things back to normal. But for the time being, we just echo everybody else's concerns that do the right thing, encourage people to really just take the strain for a little while. Let's get this done, and then we can get back to having fun again.
Thanks, Sean. And I'll a question here for you as well that has come in. Does Delta or any other airline currently having direct flights that are operating now coming in from New York?
No, we do not.
Okay, that's what I thought. Okay, so we got that question clarified there. So, Mayor, if you're still on the line, there aren't any flights coming in to Hilton Head Island from New York. We're going to move on to our next caller, and that is Chris Kerrigan. Chris is the CEO of the Community Foundation of the Lowcountry, and he's new to us as a speaker. And the Community Foundation of the Lowcountry has just put together a fund that's going to be very, very helpful to our community. So our team thought it'd be great to have Chris on and talk a little bit about that.
Well, thank you, Bill, for the opportunity. We've been here on Hilton Head Island for 25 years, supporting the needs of not-for-profit organizations and the needs of people. First off, we had a conference call and a survey of local not-for-profit organizations over the last week. I can tell you this, most, if not all, organizations, not-for-profits, are trying to do most of their work with their clients being limited to digital first. They're trying to withhold individual client, counseling, food pantries. They're trying to, keep lines separate and trying to do all the safety precautions. Food insecurity is by far the number one issue that most not-for-profit organizations are facing right now. There's simply no food to go around. Kroger's empty, Paris Theater's empty. We will be using our parking lot today as a staging ground for second helpings. So they're getting a deposit of food, and those food then will be moved into smaller trucks to be delivered out to organizations. Interesting, in times of disaster, telehealth is now being one of the more promoted issues in order to deal with this health crisis effectively. So it was great to hear that earlier on the phone. But as everybody knows, when it comes towards the end of the month, and it'll go from food insecurity to rental and utility assistance programs, because they're going to be on the rise. More and more people unemployed. That means significant challenges. School shutting down means also that after school programs are shutting down. So parents under tremendous stress
not only taking care of the kids, trying to figure out a way to get their work done, but just trying to do the work-life balances. And with that, unfortunately, comes the fear of greater domestic or child abuse problems as mom and dad are unemployed and 3 kids at home, and they're at the ages of 7 or 8, and unfortunately, bad things can happen with it. So we're proud to announce, and now we're the community foundation of the Lowcountry. There are other community foundations in our area, so there's many different charities in this area. So we would encourage you to support your organizations that you know and love, but we're unique in the sense that we have set up a $100,000 challenge match. So if any organization or any individual wants to make a contribution to the community foundation of the Lowcountry, we will match that dollar for dollar for the first $100,000. The first phase, we assume there'll be multiple phases because who knows how long this is going to last, but the first phase will support health and human service not-for-profits with deep roots in the 4-county community who have strong experience working with residents without access first to health care or who are food or housing insecure. This focus will be on increasing resilience in the populations being addressed by the economic impact and the reduced lost work of this COVID outbreak, and particularly the most economically and vulnerable populations. We want to partner with everybody. We're thrilled to be on this call. Bill, we appreciate your leadership and support. I know my wife and I have dedicated ourselves. We're going to eat 3 meals out a night. Our waistlines are going to grow, and we're going to start off tipping at 25%. We just all have to pull together at this particular point to support our community and those who are in need. And we encourage any individual or business who's on the call, if you want to support this fund, just go on our website at www.cf-lowcountry.org, and you can make a contribution online, or you can always send us a check, or you can always just give me a call directly.
Chris, thank you.
Any questions?
Thank you. We appreciate that update and what you're doing. And thanks for mentioning the takeout blitz that's going on, and just as important, the piece about tipping. You're right.
Yeah, that's right. 25%. 25%. Just do it. It's a.
Well, thank you. We were hoping that Senator Graham would be able to get a chance to break away to dial in this morning with the approaching vote. He thinks his time is best spent right now trying to make sure that bill gets through. So we will not have him joining us today, and his staff certainly sends his regrets, but wanted each of you to know that he's working hard for all of us. We will hopefully have him on our next call. I'd also like to remind you that each one of you should have received in your homes information about the census. It's important that gets completed, and since there's more time being spent at home, hopefully more people will have a chance to complete that and get it sent in. This afternoon, we're doing another call similar to this, but with our faith leaders. We think that's certainly a very important group that we need to hear from, and that'll be taking place this afternoon. We look forward to doing this again next week. Remember to please take care of yourself and take care of your friends and your family. And as long as we're sticking together and working through this together as a community, we'll come out of this in a strong fashion. So thank you for joining us. Let us know if there's anything that your chamber can do for you in these times, and we appreciate your support. Have a good rest of the day. Thank you.
Great job. All right, bye.